Hello everyone, this is Dr. Tom Chaney from Living Health Integrative Medicine in Annapolis, back with another video. In this video, I want to discuss nutrients that are depleted by common type 2 diabetic drugs. So we see a lot of diabetics come into our office and we run nutrient profiles, and we see that many of them come in nutrient deficient, and there's very specific nutrient deficiencies that we see. And a lot of these nutrient deficiencies are supported out there by the research. And so I want to go through that with you today. So there's medications that cause nutrient deficiencies. And I'm going to also add that when you have a chronic disease, you're going to have a higher need for certain nutrients. So your body's going to use those nutrients up quicker. And you're going to see as you get older, you're going to need to supplement for certain nutrients just because your body cannot make them as efficiently when you were younger. So this website here, chiro.org/nutrition, this lists some of the common drugs to use to treat type 2 diabetes. You can see them all listed over here on the left. You can see my cursor here. And then we've got some of the common nutrient depletions or deficiencies that we see. So CoQ10, very common that we see that is low. Vitamin B12, vitamin B9, and then CoQ10 is listed again down here. We've got them separated. I'm going to focus on metformin because metformin is the most commonly prescribed type 2 diabetic drug out there. B12, folic acid, CoQ10, and those three we see very common. I'm going to touch on a few others as well that research has shown. These medications can cause depletions in other nutrients as well. But I want to talk about some of the potential issues when you see deficiencies in these nutrients. So with B12, of course, there's a specific type of anemia associated with B12 deficiency. You can see fatigue, lack of energy, weakness, and then also an increased risk of cardiovascular disease. So as a type 2 diabetic, you're already at an increased risk. So this deficiency is actually increasing that risk. And then folic acid. So once again, anemia, you can see birth defects, cardiovascular disease, and cervical dysplasia. And then CoQ10, you're going to be at a higher risk for high blood pressure, which once again, as a type 2 diabetic, you're already at a higher risk for high blood pressure, congestive heart failure, and low energy. You've got the abstracts down here, or actually the links to the research papers that are referenced up here in these nutrient deficiencies. So you've got that for your reference. I'm going to skip over to this research paper. And so the title of this research paper is Metformin and Micronutrient Status in Type 2 Diabetes. As I stated, metformin is the most commonly prescribed type 2 diabetic drug, so that's why I'm really focusing on that specific medication. Now, once again, I'm not saying to stop these medications, but I think you need to have a conversation with your doctor if you're taking these medications on, what you should be doing to offset the deficiencies that some of these medications can cause, so that you don't have some of these issues, so these depletion problems. So if you're fatigued, which when I talk to my diabetics, most of them are experiencing fatigue and tired and just lack of energy. So this is why I'm going over this, so you can have that discussion with your doctor. All right, so metformin and micronutrient status in type 2 diabetes. So this is a paper that looked at how metformin affects the body in type 2 diabetics. And, it talks about there's an abundance of evidence that metformin use is associated with decreased risk of B12, but it went on to basically show that there's other nutrients that are depleted as well. So you can see right here, there's a growing evidence that other B vitamins, so like B9, vitamin D, super important with insulin receptor sensitivity if you're a type 2 diabetic, and magnesium may also be impacted by metformin and metformin use, in addition to alterations in the composition of the microbiome. So now we're talking about impacting gut health, which we know gut health is very important for many different functions, including blood sugar regulation, which a lot of people do not realize that. So we're going to touch more on that in just a minute, but I want to go back up here to the B vitamin. So the other complaint that I hear from a lot of type 2 diabetics is memory issues. So lack of focus, memory, trouble finding words. So B9, B12 also very important in cognitive function. So another impact or another way that these deficiencies can affect a person that is taking this drug. Okay, so now it goes on to say that so we've got these alterations in the gut microbiome, and what happens or what they've shown is that as many as 40% of type 2 diabetics are reporting gastroesophageal reflux disease. So they're experiencing GERD, and so that's a very common symptom that I hear from patients. And so when you go to the conventional doctor and you tell them that you're suffering from this annoying, burning sensation, and it's very, it can keep you up at night, trouble digesting food. What do they typically do? Usually they prescribe a medication. The PPIs are very, they're very common to be prescribed, and I see those on intake forms quite routinely. And what this paper went on to show is that this can have an additional effect of depleting vitamin B12 status. So, and I'll elaborate on that a little more. And when you have this alteration in the gut microbiome, you're really not going to be absorbing nutrients as well. So this can also put an additional risk of nutrient deficiencies in place. So I wanted to go over that paper. So you can find this paper at, I'm on NIH's website. So if you just go to nih.gov and then you just type in metformin and micronutrient status in type 2 diabetes, I'm sure this paper will come up and you'll have access to that. So what do you do about it? Well, what I'll do with a patient is I'll help them supplement and find the right dose of supplements to counteract these depletions. We also want to actually get them to the point where we get the body functioning so that they don't need the medications, and therefore the medications aren't causing depletions in the body. So that's the ultimate goal. So let's talk about some of the nutrients. So vitamin B12, you can get this one in liquid drops. So I'm on livinghealthmarket.com. These are the supplements that we prescribe our patients. I'm confident that these are very high quality, high potency supplements. So this is the B12 that we use. And like I said, it comes in drops. It's in a liquid form. Active B. So this gives you a wide range of activated B vitamins that are easy for the body to absorb and utilize. So you can see carbohydrate metabolism. So if you are a diabetic, it's going to help with supporting the breakdown of carbohydrates, supporting a healthy nervous system, your adrenal glands, which is also an important piece of the puzzle when it comes to blood sugar regulation. Also immune function, cardiovascular health. Once again, if you're a type 2 diabetic, this is going to support a healthy heart. And then healthy mental function and mood. So all of those are key to living a healthy life. Magplex, let's talk about Magplex. It has several different essential forms of magnesium. So going back to this paper here, it talked about magnesium here may also be depleted by metformin. So Magplex is a great supplement. And then CoQ10, we talked about CoQ10. CoQ10 is listed with all of the type 2 diabetic drugs out there. So this is CoQ10 so it's emulsified. So it's very easy for your body to digest. So if you do have gut issues, this supplement is going to be very easy for you to absorb. It also comes with PQQ, which supports healthy mitochondria. Mitochondria, that's the powerhouse of your cells. So this is an awesome supplement. This is something you want to refrigerate. So it's going to come. This is also, like I said, in a liquid form, and you're going to get it and put it in the refrigerator and keep it in the refrigerator. Ubiquinol 200. So ubiquinol is the activated form of CoQ10. So if you wanted to not do liquids, you prefer pills, then this would be your supplement. So once again, supporting antioxidant activity, lymph and blood and cell membranes, fully reduced form of CoQ10. Once again, very easy for your body to convert this and utilize it. So this is going to be your pill option if you want a pill rather than a liquid. And then the other nutrient that was mentioned in this research was vitamin D. So this is our D3 2000. This is also a liquid. It comes in a dropper, and you just drop it right on your tongue, and very easy to absorb. But once again, this is something that I see most of my diabetics coming in deficient in. And so when you're lacking vitamin D, this is essential for the insulin receptor sensitivity. It's also very important in immune function support. So supporting your immune system with this is very important as well. So you've got the D3 2000 here. So all of these are at livinghealthmarket.com. You can check them out there. Once again, this research paper you can find on NIH's website. And then this is at chiro.org.nutrition. This is the nutrient depletion checklist, and it goes through the different drugs, nutrient depletions, and potential problems that these nutrient depletions cause. All right, guys, so I hope you got some great information from this video. If you have any questions, leave them down below. If you haven't already subscribed to our channel, go ahead and do that. Share this with friends. If you know someone that's a pre-diabetic or type 2 diabetic, and if they're taking these drugs, then definitely you want to share this and have that conversation with your physician and ask them, what should you be doing in order to make up for these depletions. All right, guys, I'll see you in the next video. Have a great day.